Good afternoon, everyone. I'm Jerem Ruby.
And I'm Gina Brock.
We're second-year medical students from the Idaho College of Osteopathic Medicine in Meridian, Idaho, working under the mentorship of Dr. Joseph Williams, a urologist from the Idaho Urologic Institute.
Today, we would like to talk with you about what we have learned regarding female stress urinary incontinence.
We'd like to invite you into our classroom and give you a general overview of this condition before your visit with a urology specialist.
Our hope is to help you make informed decisions about your care. We may be able to answer some questions you have regarding this condition and its treatment, or provide information for you to ask your doctor during your appointment that you might learn after watching this video.
So come with us, and we'll teach you what we've learned. A urologist is a surgeon who is trained to diagnose and treat diseases of the urinary tract in both men and women, including anything involving the reproductive tract in men. They may remove cancer or open up a blockage in the urinary tract, such as a kidney stone or enlarged prostate. Urologists treat many diseases, and some even further specialize into the study of female urology, male infertility, pediatric urology, and many other subspecialties.
A type of urologist that specializes in disorders of the female urinary system is a urogynecologist. A urogynecologist is a surgeon with training in urology, gynecology, and obstetrics, who focuses on the evaluation and treatment of non-cancerous conditions that involve the female pelvic organs and their supporting muscles and tissues, as well as pelvic reconstructive surgery.
All are highly qualified to diagnose and treat urinary incontinence.
In this video, we will focus on the female urinary system. The urinary system consists of 2 kidneys that filter waste out of the blood to produce urine. They have other functions like controlling blood pressure. You have 2 adrenal glands, which are located on top of each kidney that release hormones. The ureters are tubes that drain urine from the kidneys and empty into the bladder. There is only one bladder that serves as a hollow sac to store the urine. It has an internal sphincter, or circular muscle, to allow your body to control the flow of urine. This sphincter prevents you from wetting the bed at night. The urethra functions to serve as a tube to drain urine from the bladder out of the body and has an external sphincter that allows you to consciously control urination. Lastly, there are pelvic floor muscles that support structures that lay or pass through the pelvis, which include the bladder and urethra, along with other structures.
Urinary incontinence is when you have less control over when you urinate and may suffer from involuntary leakage of urine. It can be temporary or long-lasting. There are different types of urinary incontinence. Urge incontinence is what happens when the muscles that control your bladder is overactive and suffers from uncontrollable contractions. You might feel you can't get to the bathroom fast enough and may even know where all the restrooms are along the way home. Stress incontinence occurs when there is injury to your pelvic floor muscles that may occur due to multiple pregnancies, whether you delivered vaginally or by C-section. Sometimes injury may occur with hard, difficult labor during one childbirth experience. You may experience urine leakage when you cough, sneeze, laugh, or exercise. Mixed incontinence is as it sounds. It is a mixture of symptoms of urge and stress incontinence. Overflow incontinence is when your bladder just continues to fill up and then overflows. This can occur if the bladder is blocked from draining or if there is inadequate contraction to drain the bladder. Neurogenic incontinence occurs due to many conditions, but involves illnesses related to the connection between the nervous system and the urinary system. If you can't tell when your bladder is getting full, this may be a neurologic problem.
Now that you know the different types of urinary incontinence, you can understand how they share similar symptoms and why it is important to figure out which one you have. In order to help do that, your doctor will need to take a focused but a thorough medical history. You may have already completed a questionnaire with your primary care physician, but it's likely the urology specialist may repeat some of the questions already asked, including very personal questions like, how often do you urinate and how much? Does it occur in your sleep or with activity? Do you have pain or blood with urination? Do you use sanitary pads to catch your urine? If so, how often and how many? Do you have pain with sex? And when do you experience this pain? Have you ever had children? If so, how many? And how did you deliver, vaginally or by C-section? And were there any complications? Have you ever had surgery or surgery for urinary incontinence? What is your family history and what type of medications do you take? What do you do for a living? Do you smoke, drink alcohol, or use drugs? How much caffeine or water do you drink a day? Do you have any intestinal symptoms, rectal fullness or pain, or abdominal, back pain, or neurological symptoms? How much do your symptoms bother you? A little or a lot? This may seem like a silly question, but it helps the doctor to figure out which type of urinary incontinence you have and how to treat it effectively. At this point, you may say, I'm bothered by being asked all these questions. There are many that we haven't discussed, but understand that it's necessary, though it may seem exhausting. All of this information is extremely useful in your treatment plan.
Your doctor will likely do a focused and thorough physical exam. Your primary care doctor may have completed an abdominal or belly exam along with a pelvic exam. You may wonder why the specialist might need to repeat these. The best way to explain it is your primary care physician needed to do an exam to narrow down your symptoms to an illness. After discussion with you, they recommended that you see a specialist for urinary incontinence with concerns. For instance, you may need surgical repair. Now the specialist wants to repeat some of the exam you already had with your primary care doctor. It can be confusing and irritating, but often the surgeon needs to feel the tissue texture and gauge how much urine leakage you have in order to make a recommendation on further evaluation or course of treatment. The doctor may also need to do a rectal exam. Sometimes the only way to assess the pelvic floor muscles and pelvic structures properly is through a rectal and pelvic exam. The pelvic exam may occur with a full bladder, even in the standing position. Rest assured, your doctor will tell you what they want to do and how they want to examine you to make sure they get your permission to do so. Nothing will happen without your full consent.
It is likely you will need to do testing to complete the evaluation. At this point, we will focus on the necessary testing to evaluate you for stress urinary incontinence. The two most common tests are a urinalysis and what's called a post-void residual urine. A urinalysis is when you urinate in a cup that is sent to a lab to look for substances in your urine that shouldn't be there, such as blood or infection. A post-void residual urine is when the doctor sends you to the bathroom to urinate and then looks to see how much urine is left in your bladder using either an ultrasound machine or a catheter. Other tests that may be a bit more invasive may include a cystoscopy and urodynamic testing. It all sounds complicated, but allow me to explain. A cystoscopy is when the doctor uses a specialized camera to look into your bladder for signs of swelling, blood, infection, tumors, or blockage. If necessary, they may also get a biopsy of a suspicious area. You might ask, well, how do they do that? Usually, if done in the office, a numbing medicine is applied to your urethra to make it comfortable to look at the lining of the urethra and bladder with a small camera. Sometimes the doctor may want to do it under anesthesia, but they will discuss that option with you. There are many tests that are used and fall under the category of urodynamic testing. The specialist will decide which one is best to evaluate you. However, most include a computer attached to a small catheter. The catheter is placed into your bladder to allow the flow of water to fill your bladder. You may be asked to try to urinate or just sit there as a technician collects information that records the volume and pressure changes in your bladder or urethra. This is usually done in the office by a skilled technician or by the urologist.
After the specialist completes a history, physical exam, and any necessary testing, they will make a recommendation to you. Stress urinary incontinence can be managed with or without surgery, depending on how much it bothers you and the findings discovered by your doctor. Non-surgical options to control your symptoms may include some things you might have already tried with your primary care doctor. Those include Kegel exercises, which are localized pelvic muscle exercises to strengthen your pelvic floor muscles. Pelvic floor training by a physical therapist or a DO physician who practices osteopathic manipulation treatment, or OMT. Treatment using this therapy helps you to localize your Kegel exercises to the right area, as you might not have been doing them correctly. Or they use other methods to help you strengthen or relax the pelvic floor muscles to reduce your symptoms. Other things include a bladder diary. It may be recommended you record when, how often and how much you urinate, and if you use sanitary pads to catch your urine. Behavioral therapy is useful as well. You might be asked to try to control urination or to try to urinate even when you don't feel like you have to. As far as surgical options go, there are many, and their recommendations vary based on your age, medical history, physical exam findings, and testing. These specific options, success rates, and surgical complications will be discussed with you by the specialist. Together, you will decide what is best for you.
Now, you are ready to go to your urology appointment. Let's head over there now.
Well, you made it to see your urology specialist at the Idaho Urologic Institute.
We congratulate you on making it here and hope we have provided you with enough information to encourage you to speak more with your doctor here at IUI.
We wish you the best of luck on your journey to learn more and obtain successful treatment of your stress urinary incontinence. Please feel free to complete your tour of our campus at the Idaho College of Osteopathic Medicine and visit the providers here at the Idaho Urologic Institute.